Here's a clip from the Integrative Wellness and Development podcast, where guests discuss Texas Southern University's perspective on innovation, access, and their role in advancing new approaches in healthcare.
Yes, when I asked them about that, they said, well, why not us? We were pioneers when Black doctors weren't even allowed in medical schools. We pioneered that way. And so, of course, we would pioneer this into the world because, Big Pharma doesn't want this information out there. If there's a better way to treat cancer, that destroys a multi-billion-dollar industry. And they don't want that industry disrupted. Of course, if you just follow the money, it makes sense. But because the Black community is underserved anyway, and they can use this to prevent the things that they have historically seen in the worst numbers. They die of diabetes more, they die of hypertension more, heart disease and cancer. And so they understand the synergy, the synergistic relationship between them being the first, taking energy medicine and driving it forward and being able to document it with their PhD students. They see that as a way to make a name for their university, a way to help their community and to help an underserved population.
That was a discussion from the Integrative Wellness and Development podcast, highlighting perspectives on innovation, equity, and emerging approaches in healthcare. Conversations like these invite us to think more broadly about access, research, and community impact.